My name is Holger Wicht from Deutsche Aidshilfe, a big German HIV organization and publishing house. And my question is, crucial for the success of a testing program is that individuals know that in case of a positive result, they have access to antiretrovirus therapy. So how is the coverage rate in Canada right now? Does everyone have access to antiretrovirals in case of a positive result, and who's paying for this? Health insurance, or is it governmental programs, or how is it working here?
I will want to invite Jody and Ken to provide their own perspectives, but if I may start this time first, this is another example, another reason for which, unfortunately, fewer people want access to a test or a diagnosis because of stigma, discrimination, exclusion, fear, anxiety of knowing the result of the test or reasons for which people don't want to be tested. Now, sometimes people don't have access to a test, which is equally worse. But no, this is another reason that if you get tested and you end up being positive, then what happens? If you fear or feel that you won't be able to access the treatment that you need to protect yourself and your loved ones in your community, then it may be one more reason for which you don't really have the will or the ability to know about your status. So that's one more reason for which we need to ensure that everyone who is diagnosed gets the treatment and the services that the person needs.
But how's the situation now?
Yeah, if I might add. Canada is a patchwork of accessibility across the country. Each province and territory has its own system. For a long time we were quite proud in Quebec of our medication insurance system. There are costs involved to it, so those can exclude people. And we also know that there are people who don't have status that gives them access to health coverage here. Our organization has currently a project which depends on the charitable actions of doctors who are willing to see patients for free, of a laboratory, a public health laboratory that is assuring the follow-up, and the generosity of pharmaceutical companies to provide their products for free. That isn't an answer. That isn't a solution. We really need to get to a place where everyone who is on the territory has medical care, complete medical care.
I still don't understand how many people already have access and how many don't.
Yeah, it's very hard to count the people who don't have access. I think it's one of the things when we look at our 90 results that Canada arrived in 2020 at 87% of people who were diagnosed having access, but those are the people who are officially in the system. So it's very hard to count the absent.
Thank you.